So what's heat balance? Heat balance is basically heat gained versus heat lost. So basal metabolism of a 70 kilogram man produces 72 calories per hour of heat. So the way it's calculated is basically 40 calories per meter square per hour multiplied by 1.8 meter square body surface area. If no heat is lost, body temperature can rise up to 2 degrees Fahrenheit. How does that happen? Basically, rise in body temperature can be calculated by following equation. Heat gained is equal to mass multiplied by specific heat and multiplied by temperature change. Heat gained is in calories and mass is in kg, and specific heat is the amount of heat required to raise the temperature of any object by 1 degree centigrade. So due to higher water content in human body, specific heat of body is 1. So temperature change is calculated by subtracting final body temperature after heat is absorbed from initial body temperature. So 72 calories per hour of heat gained equals to 70 kilograms multiplied by 1 degree centigrade per hour multiplied by delta T. Delta T is 72 over 70. So delta T is equal to 1.02 degrees centigrade, and that when it's converted it turns out to be 1.8, which is equal to about 2 degrees Fahrenheit. So this monitoring of body temperature is critical for low birth weight neonates and critical care patients that are patients undergoing heat stroke, heat stress, malignant hypothermia, or neuroleptic malignant syndrome. And this is a quick article you can see as well. Anytime you have deviation from that heat balance, you can have hyperthermia. And when you are in exercising or you have a fever, body temperature raises about 38 to 40 degrees centigrade. Anytime you have heat stroke, remember heat stroke has different steps. First you have heat cramps, then you have heat exhaustion, then you have heat stroke. So at heat stroke, body temperature is about 40 to 44 degrees centigrade. And anytime you have brain lesions, that affects the thermoregulatory hypothalamic centers, and that causes an increase in temperature as well. And then severe hypothermia occurs when body temperature is more than 44 degrees centigrade and you have temperature regulation is lost. If you have hypothermia, mild hypothermia is between 34 to 36 degrees centigrade. Moderate hypothermia, you have that is at 30 to 34 degrees centigrade, and this basically at this temperature you have impairment of temperature regulation in your hypothalamus. And severe hypothermia occurs at 27 to 29 degrees centigrade, and you have severe cardiac arrhythmias and temperature regulation is lost. And why do you have cardiac arrhythmias? And your books will just mention the name cardiac arrhythmias and never explain anything. Basically, I'll explain you more in detail of why do you have cardiac arrhythmias. But quick understanding is that low temperature, anytime you're hypothermic, that basically irritates the conduction system of the heart, and that is the quick explanation of cardiac arrhythmias.